Hi everyone, it's Sarah from Sarah Gale Nutrition, and this week it is Endometriosis Awareness Week, and I want to help increase the awareness. So this blog and video this week is going to be all around what is endometriosis, what are some of the signs, and what we can do about it. So what is endometriosis? Well, it's a painful and sometimes debilitating condition that affects around 2 million women in the UK alone, so not globally, just in the UK. Most women are diagnosed between 25 and 40, and shockingly, it can take on average 7.5 years for women to be diagnosed. It is a long-term chronic condition that occurs when the cells of the uterus grow outside the uterus. So often on things like the ovaries, fallopian tube and the intestines, so things around the uterus, but actually they can be found anywhere in the body. So doctors have found endometriosis tissue in the eyes and the brain. And I actually recall when I was training, I had a client that had endometriosis and she had it in her shoulder. So every month she would have effectively the tissue that had transferred from her uterus up there would bleed. And that is the problem, because those cells and tissue that travel are hormonally active, just like the ones found in our uterus. So once a month they are listening to the hormonal cues and they bleed, but the blood doesn't have anywhere to go, so it can build up, causing scar tissue and cysts and lesions. And because they can grow anywhere in the body, actually the symptoms can be quite wide-ranging. Common symptoms are very painful periods and cramps, so enough to stop you, to floor you and stop you doing your everyday activities when you're on your period. Heavy, very heavy or long periods. IBS-like symptoms, so it could be constipation, diarrhea, bloating or gut cramping. Painful sex, infertility, fatigue, UTIs and bladder problems as well. Pain in your lower stomach or back pain is quite common as well, and also pain when peeing or passing a stool during your period. The only way to officially diagnose endometriosis is by a laparoscopy, which is an operation in which a tiny camera is inserted in the pelvis. If you have any concerns, any of the symptoms I've just gone through, and you're thinking, ooh, actually maybe this might be me, I really encourage you to go to the GP to check out what is going on for you. There is currently no cure for endometriosis. Treatment currently involves surgery or use of the birth control pill or medications just to help control the hormones. It might sound really bleak, but there is so much that can be done through diet and lifestyle, which is an effective way to manage your symptoms. So what are the underlying causes of endometriosis? Well, I will say there are three that are thought that play a factor in endometriosis, but actually it still needs to be researched, but researchers aren't 100% clear. But the three known ones at the moment are inflammation. So endometriosis is an inflammatory condition, and it is often also driven by inflammation, so a horrible vicious cycle. And inflammation can come from our environment, so the food we eat, the toxins we're exposed to, the lifestyle we live, and just the state of our gut, just to name a few things where inflammation can come from. Number two is a faulty immune system. So the immune system's job, we might not always think about this, but the immune system's job is not to react. So currently it's not reacting to my top, it's not reacting to the chair I'm sitting on, it's not reacting to the products I use in my hair. And actually that is correct. We don't want the immune system to overreact. So it shouldn't actually think the breakfast I've had this morning is going to spark World War III in my stomach. We don't want the immune system to react. However, some of the time it is appropriate for the immune system to react, so such as times when we ingest a pathogen or bacteria, and actually when the cells or tissue from the uterus go elsewhere in the body, that is an appropriate time when the immune system should attack and break those down. And actually it's found in endometriosis that reaction doesn't occur, which allows the tissues to build up and can cause cysts, lesions and scarring. Number three is estrogen overload. So estrogen, or too much estrogen rather, fuels endometriosis, making it worse. This can come from an imbalance in your estrogen, too much estrogen being produced, difficult detoxing it or eliminating it, as well as external estrogens and xenoestrogens, which are found in our environment. Xenoestrogens are foreign estrogens, so they work very similarly to our naturally produced estrogen, but they're far more potent. They're found in things like pesticides, cleaning products, beauty products. I'll be going through what we need to do to reduce our environment next, actually. So what can we do? Spoiler alert, we can look at our environment. So we want to eliminate our exposure to those toxic xenoestrogens as much as possible. So look at your cleaning products, your beauty products, cosmetics, pesticides, and plastics as well. So they all work to mimic estrogen in the body, so we want to reduce our estrogen load as much as possible. A really nice way to start is just start by reducing the numbers. So actually, do you need to use 5 cleansers, 2 toners, 3 serums and a moisturiser in part of your daily routine, or would actually a cleanser and a moisturiser cut it? Same with the cleaning products. Do you need 5 different cleaning products to clean your bathroom, or actually would just one do the job? So work on reducing the number of products you use first, and then start to look at, can you find cleaner and greener alternatives? So the Think Dirty app and the EWG is the Environmental Working Group are really good sources to get started with that. It is also wise to opt for organic to reduce your exposure to pesticides and herbicides, as well as reducing your plastic use as much as possible, particularly the plastic that comes into contact with your food and drink. So number 2, what we can do is optimise our diet. So what do we need to add more of into our diet? Well, I'm sure this comes as no surprise. Dark leafy greens. Dark leafy greens are amazing for everything, but things like dark leafy greens, cruciferous vegetables, berries and other high fibre vegetables really support the gut and the liver. So the liver is responsible for breaking down and eliminating that excess estrogen, and once it's detoxified, it is excreted via the stool. So other foods that really support the liver are things like artichokes, beetroot, lemon and lime and burdock, which are all great for liver health. Including in more fermented foods to help the gut is also great, so think of the 3 Ks, so kimchi, kraut, sauerkraut and kefir. You can also work on adding in more healthy fats, which helps to support healthy hormone production and healthy balance between all the hormones. So things like coconut oil, oily fish, olive oil and avocados are great for this. And make sure to include sufficient protein, which helps to balance out our blood sugar levels and reduce excess insulin, which can then help to reduce estrogen levels and keep inflammation at bay. So what do we then need to look at reducing in our diet? So red meat has been directly associated with endometriosis in research. So opt for leaner sources of animal protein instead. So things like white fish and chicken, which are generally less inflammatory. Get rid of sugar. I might sound like a stat record here, but sugar is just an inflammation bomb for the body. It can also suppress the immune system and mess with your hormone balance. There's really no benefits when it comes to endometriosis or your health for that matter. Try to limit processed foods, which contain things like additives and preservatives. So not only are processed foods generally lower in a nutrient content, but often the added chemicals give the liver an extra workload. So actually it's going to prioritise detoxing those over your estrogen, which is what we want it to do. Consider your intake of alcohol and caffeine. So alcohol is particularly inflammatory. It can suppress the immune system, it's hard on the liver and damage your gut bacteria. Caffeine is a little less cut and dry, but there is some research linking caffeine use with endometriosis. So best to play it safe and actually cut it out or reduce your consumption of caffeine and coffee. Number 3 is working to support the immune system. So trying to eliminate foods that we know spark inflammation on the immune system most, so things like gluten and dairy are the top 2 offenders, can really help to support the immune system and reduce your inflammatory load. Load up on brightly coloured vegetables, so eat the rainbow, which are really rich in antioxidants and can help support your immune health. Garlic, ginger, mushrooms, green tea and berries are all especially good for the immune system, so make sure you load up on those. Make sure you check your vitamin D status all year round, but particularly through winter, because in the UK we do not get enough sunlight exposure to make vitamin D. So it can be tested through a simple blood test, and then you can supplement accordingly if required. Number 4, support your detox pathways. So support all your detoxification pathways, not just the liver and gut, which we've gone through. So make sure you sweat daily, either through exercise, hot baths or saunas. Add in some body brushing. Make sure you go upwards towards the heart, or rebounding. So these little mini trampolines which you can bounce on, they're called rebounders, which really helps to get the lymph flowing. Breath work can be a really useful detoxification resource as well, because we detox through our breath. Hydration is really important for the kidneys and just making sure we flush everything through, as well as having a good old cry if we need to, because we detox via our tears as well. Number 5, manage our stress. So when there's stress, there is cortisol. And producing high amounts of cortisol can knock your other hormones out of balance. It can also suppress the gut and liver, which is also not good for our hormones. So try to prioritise daily relaxation just make it part of your everyday life. It could be as simple things as going for a 10-minute walk, doing some stretches in the morning, or reading a book for 10 minutes before bed. It doesn't have to be lengthy, but just make sure you prioritise it daily. Number 6, take targeted supplements. And I'm going to sound really vague here, and this is because they should be targeted. I view supplements as exactly what they are, a supplement to what you're already doing. So what we're going through in terms of diet and lifestyle is a really good foundation. But actually when you work with a practitioner, targeted supplements can help give you quicker and faster symptom relief. And number 7 is testing. So using a comprehensive test like the Dutch test, which is a dried urine comprehensive hormone test, to really help understand what your estrogen and other hormone levels are, and also how well you're detoxifying it, is invaluable information to understand where you might need targeted support. Remember, if you do think endometriosis might be part of your picture, then please go to your GP as your first port of call. However, if you'd like to understand more about how Dutch tests or supplements or anything else in terms of diet and lifestyle more personalised to you could help you and your symptoms, then please do reach out and book a call to discuss more.